Welcome to Podiatry Marketing. I'm your host, Jim McDannald, joined by always Tyson Franklin. How's it going, Tyson?
I'm good, Big Jim. How are you doing?
Things are good. Things are good here in Montreal. Loving life. No complaints on my side.
Yeah, and say there shouldn't be. Life is good. I always tell people that life is good. I was talking to someone earlier today, and we were talking about how you can sometimes get a bit down, or you might have that patient, could be the first or second patient in the morning, and they do something, they get under your skin, and some people will let that ruin their whole day. And they'll actually say, "Oh, that patient has ruined my whole day." And I'm thinking, well, you actually have the choice to let that patient ruin your whole day, or you can decide to not let them ruin your whole day. So a while back, someone said, let them ruin your day for half an hour. So give yourself half an hour to be really annoyed, throw things around, have a tantrum, have a bit of a sook, get a tissue, and then just go bang, and then just get on with it, because the rest of your patients deserve you to be at your best.
I think it's a tune and a good mindset. That's similar to what my dad used to give me some advice after a bad race. You can be mad at yourself for a couple hours after your bad race, but then it's off to the next thing, or you can't you can't focus on that, or just going to take things over. So I like that advice.
Yeah. Yeah. And they say that it's about elite athletes in all areas. Doesn't matter what they're doing. They can take the loss, take it on board, and be upset about it for a very short period of time, and then they just move on. Okay, I've got to start training again. Whereas I was actually watching the LFA last night, which is like a cage fighting competition. And there was a guy, debut fight. It's his first professional fight. And when they came out to shake gloves, to touch gloves, the other guy who was more experienced had a few fights already and was undefeated. So this amateur, who's now pro, comes together. You can see just had this attitude and swagger in his walk. When it came to touching gloves, he wouldn't touch the other person's gloves. And he was also the favorite to win based on all his amateur fights. Anyway, he got smoked. He got choked out in the first round and lost. He was so shitty. Normally when that happens, the ref breaks up, they celebrate with the team. Then they both come over and they sort of like hug each other. No, refused. In fact, he just wanted to start throwing punches again. And even when the ref was holding their hands up, he refused to acknowledge the other guy. And I was sooking so much. And I went, wow, that was really, this is a professional fight thing. That was very unprofessional.
Yeah.
And if I was an outside organization looking in and looking at that person, I'd be going, no, I wouldn't sign him up. Don't need that attitude in our organization. So it has nothing to do with what we're talking about today.
No, but I think it's fun to get these little anecdotes and kind of see it. The listeners can hear how we address certain problems when things come up, and maybe they can, take it or leave it if it's something they want to kind of institute into their own practice or their own lives. So no, I love hearing these little stories, but back.
Well, I think it's important how you work day to day and how you deal with certain situations. You realize it's not just you dealing with it, your team are watching you. So if you want your team to perform at the best, you can't be kicking things around and slamming doors and having a big sulk, because then your whole team says, "Oh, I'm having a hissy fit again," and no one wants to be around that.
No, for not at all. So, but back to the what we're talking about today. What's the topic?
I forgot.
The topic du jour.
The topic today is open loop technique. And I'm going to read something here so I don't get it wrong. And the phenomenon of the open loop was first discovered by a psychologist and a psychiatrist as well, Dr. Bloomer. I always get this wrong. Zeigarnik. Yeah, Bloomer Zeigarnik. She discovered what is now known as a Zeigarnik effect, which is the open loop. And it's a tendency for our brain to sort of remember and focus on incomplete tasks more than it does on complete tasks, which sounds bizarre. So if there's a task or something that's happened and it's incomplete, it bugs with us. It actually creates anxiety. And copywriters, and especially Hollywood TV and TV writers, have been doing this to us for years. And we do know that it's been happening. You would understand what I'm talking about.
Yeah. So like cliffhangers, kind of things, on an emotional moment, and we want to know what happens next, right? So yeah,
but sometimes you'll be sitting there. Yeah, you'll be watching a new TV series. It might be 1, 2, 3 seasons in, and sometimes a season will finish, and you'll go, "Oh, I wonder if there's going to be a fourth." And you could sort of think about last episode, and if everything's been closed off, if Mary married Bobby and Dingo got out of prison, and and they saved the dog didn't die and it saved, and John, who had the heart attack, survived it at the last minute, and that plane that crashed, everybody walked away unscathed. If every story has been closed, then you can pretty well say season without even Googling it going to be another season. However, if there's a major cliffhanger where little Johnny's hanging onto a branch on the side of a cliff and all that, and it just ends there, you're like, well, does he fall or doesn't he fall? What happens? And that anxiety that builds up within us, we want to know. We will tune this week for next week's episode to find out, does Johnny, who's the star of the show, fall off the cliff? Unlikely he will, but every now and then it does happen. So copywriters, Hollywood, they've been doing their whole life, pretty much.
So taking this back to podiatry, what loops do you see within the profession, within working with patients? What are some opportunities or some examples you can share?
I reckon one of the biggest things is, and this is where I feel new graduates, or if you've employed somebody new, where they make their biggest mistake, is the patient comes in, they've got problem X, and the podiatrist, with all their knowledge, gives them everything, just dumps every injection, exercise, bit of information about, gives them handouts. Just the patient walks out and they couldn't possibly have a question because they have been told everything. They might walk out totally confused, but they've given them that patient to come back because what are you going to do with, or what are you going to tell them next? Because you've already told them everything. And whereas I think the better approach is a patient comes in with problem X, and there might be 5 things you want them to do. And you can actually say to the patient, there's 5 things that we need to address with this particular problem. I'm going to show you the first 2 today. And you get back next week, we'll see how that's going. And when you come back, we'll talk about the next 3 steps. The patient's like, oh, I've now created curiosity. They're wondering, what are the next steps? Because people don't.
No, for sure. They don't want to miss out. But I think there's all to this system, or, the way you communicate this to patients where you're not overloading them as well, right? It's kind of a stepwise process. It's this thing, this thing. If you, like you said, if you tell them everything on the first visit, it's all going to be this way, or you just dump everything onto them that first visit, it can be a bit overwhelming for the patient, not only just cognitively trying to figure out what's going on with their diagnosis, but then now they have all these tasks that you assign them to do. And maybe they weren't ready for that. But also it may not be as effective, right? We don't know if an injection is going to work for one person here and then an orthotic is going to work for another person here. There's no cookie cutter recipe to what we're doing. So this kind of stepwise, or this, this open loop provides kind of them to you to build trust over time with the patient as well, to make sure that you're exploring all the different options they have for their care.
Yeah. And it's probably, to think of it, we've all been at a conference or an event, maybe it was a business type event. And as you go into the break, this people say, oh, and by the way, when you come back, I'm going to show you the 7 ways to do such and such, or the 10 best ways to do this with your patients. So when you're during the break, you go, oh, I can't wait to get back in there and find about the 7 ways or the 10 tips for doing certain things. So it's happened to us throughout our whole life. And you've got to realize that if you were going out on that break, and the way before you, here's a sheet with the 10 tips that you need to do with your patients, you go out there, you go, oh, I've got the 10 tips. I'm going to extend. So there's not the curiosity or reason to sort of come back. And I think with your patients, you could give them a list of the 5 ways to treat problem X. If they've got those 5 ways in front of them, and even if you only do 1 today or 2 ways today, if they already know what the other 3 are, well, there's just coming back. But if you tell them there's 5, give them 2, and then say, when you come back, I'll explain the rest. When the treatment went, they are going to want to come back to know and get more information.
I think that's an excellent point. I think it's like putting into human psychology at the same time, right? If we just give away all this information up front, they're going to be buried in it. It's not going to seem as important, but just how you communicate, or the order in which you can communicate with the patients, has a huge impact. It seems like a little thing on the surface, but from a human psychology perspective, it's going to make that feel more important or more memorable to them, and will allow you to help them more just by changing the order or dosing out smaller bite-sized chunks of information in a way that, like you said, kind of makes them curious, but also helps them, be more intentional or remember kind of what you said.
Yeah. And you can combine, on previous episodes, we've talked about storytelling and micro storytelling. Dave Freeze, a friend of mine, does this better than anybody else. He will say, oh, there's 4 things that we're going to cover this morning in today's section. And he'll cover the first one. He'll cover the second one. He'll cover the third off into a story. And he never gets to the fourth. The session, and all of a sudden you look at your notes later and you go, 1, 2, 3. But there was 4. He said there were 4. He's only ever given me 3. And then later that day or next day, you go, oh, by the way, yesterday, I was going to tell you the 4 ways of doing such and such. First way is this, second, and he goes, now remember the story I told you? He goes, can you ask questions about that particular story? What color shirt was the person wearing? What, where was the fireplace located? What did the guy in the green suit have in his hand? And all of a sudden, we're recalling all these points. And they reckon this is part of the whole psychology of it all, is when you leave something open, you're more curious about it, you retain that information. And it's the information he shared was quite important. Then he'd tell us the 4th one. You go, oh, finally, thank you.
Yeah.
So the longer, and he does this constantly, where he just, it's one open loop after another open loop after another open loop. He does this to us for 2 days solid. And then on the 3rd day, the loops.
Yeah.
But when he closes the loops, we remember the information. So if you're talking to a patient, you get 5 ways to do this. 1, 2, story. Never get to the rest. And then we go, hang on. When they come and go, oh, by the way, I forgot to tell you 3, 4, and 5. Patient goes, yeah, actually, I recall that. I go, remember when we did the second point, you remember what you had to do? We'll recall the steps, because it's just the way that our brain that we remember things when we're sort of, I reckon it creates anxiety when there's a gap between what we know and what we want to know.
Right.
There's other stuff we know that we want to know. It creates this anxiety, and we won't be fulfilled until we actually get that information.
Us as humans are interesting. It's like we want the, the one hand, the bird in one hand or 2 in the bush. We always want to go for that, like 2 in the bush, right? It's like that.
I want to know what's in there.
That next adventure, the next thing, the next vacation, the next, we're always jumping ahead. And by kind of utilizing that aspect of behavior, I think, like you said, you can make it more memorable, can make a bigger impact on the patient with communicating in that fashion.
Yeah. And I think another way that you can actually use it in podiatry, you might write a blog article. And we have a couple for a blog article, and it might be the 10 best ways to prevent heel pain on your next holiday. 5. And that might be part 1. Tune in next month's article. I'll explain the next 5. So if the people like the first 5, they're coming to listen to the next 5. It's no different to some of the podcast episodes I've done on Podiatry Legends, where I have had someone we've spoken for quite a period of time. So I've split it into 2. And both episodes usually do quite well. And when I look at, because I can look at stats the same as we do on this show,
Sure.
And you can see which countries they come from. When you look at the actual stats itself from the countries, and then you look at part 2, you almost see it's identical, because the people that saw this one to get the second part of it.
Yeah.
It's quite interesting. So I think you can do it with blog articles. You can do it when you explain instructions. Is anything that you're communicating some form of information, just hold back a little bit. Don't close the conversation. Don't close the loop every single time. Well, there's nothing for them to come back for.
I think that's difficult. I think especially when you're new into practice, right? You're kind of, you feel like you should prove yourself. And since there's no more, no more attending, no more co-resident to impress, or, you're not at a conference presenting or something. You're sitting now in front of someone who definitely doesn't have the same level of foot and ankle care knowledge as you do. And you want to show them that you're trustworthy, that you're skilled. You might be new, but you have the skills to help them out. And like you said, you got to find ways of communicating, parsing out that information. Well, not only will they retain, but just, but it's in small enough bite-sized chunks where it's just not overwhelming the patients. I think, when you tap into this open loop, there's kind of multiple benefits of this kind of way of communicating with your patients, for sure.
Yeah, and it makes it interesting for the patient. It also makes it interesting for yourself. But there's no way you'll pick up a book and you'll read half a book and not finish it, or go to a movie and watch half a movie. I got an idea of what'll happen and leave. And it's the same. I remember watching this on The Big Bang Theory, and I'm pretty sure this is talking about where Sheldon always needed closure on everything. He could not leave. If you left an open loop with him, he would go nuts. And he was going, "That's not true." So then, dun, 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 and he just had to finish off those last two things. You know what I'm talking about, don't you?
Yeah.
Yeah. So it's always dun, 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 dun. So they were done. So we are just wired to finish things off with things that have closure, to know what the information is. That's why when you see magazine articles or like a magazine cover, it'll go, "The 7 secrets to," I'm like, ooh, it's just, you're curious. So this curiosity of gathering information is everyone has it. Your patients have it. So don't give them everything. Give them enough to keep them curious to coming back. And if you do that over a period of time, you're going to get a lot better results with your patients as well.
No, I think there's definitely some learning form of communication. I definitely like those examples. It definitely is something that I think once you learn from different form of communication, something you're always kind of finding what is that way to approach a patient that's going to deliver the most impact, not only for their care, but just for you as in your private practice. And I think that's a great technique and a great kind of way to, like I said, parse out that information to patients in kind of a bite-sized chunks that, keeps their interest and, makes things resonate with them as opposed to just kind of dumping tons of information on them. That's not going to, they're going to forget it tomorrow. So.
Yeah. And some podiatrists I know may think, "Oh, but isn't this being manipulative? That you're trying to manipulate them to come back and do certain things?" Yes. But all communication has some form of manipulation. And some people go, "Oh, no, I never anyone." And I always say, have you ever told anybody a joke? If they go, "Yes." Did they laugh? Yes, you manipulated them. You did something out of them. So telling a joke made them laugh. That was what you were trying to do. You manipulated the situation. There's difference between, it's your intent is the important part. If you were trying to manipulate people for evil, like chaos, remember Get Smart?
Yeah.
Watch Get Smart on TV? Yeah. So you can either ask for good or evil. So if you're using forms of manipulation, but with good intent, there's nothing wrong with it. If you're doing it for an evil intent, or you're trying to con somebody into something, then no, you shouldn't be doing it.
For certain.
That's the part when it comes to communication, or getting better at communicating with patients and people in general, that, not just podiatrists, with like walls up that they don't want to learn anymore because they think they're trying to harm people. Only bad people harm people. Good people will never harm people. No matter what they read and what they learn, they will only ever use it for good intentions.
No, that's well put. I definitely think, we get so used to practicing our skills, being a good surgeon or a good clinician, but, boning up on, solid communication skills, whether it be, verbal or nonverbal, is something that I think a lot of people in practice, either you're born with it or you practice it in some other way leading into, being a clinician. But if people haven't done it in their past or have a lot of practice, I think that's something that a lot of podiatrists could improve on. And it really benefits not only yourself, but also your patients when you can have clear communication in ways to, like I said, help them receive the best care.
Yeah. So, Jim, I have nothing else on the topic to talk about. Well, we could talk for hours, but I won't.
Well, I think that was a great sum up of Tyson. Thanks for that. And just want to make sure that everyone that's listening today, make sure you go to iTunes or Spotify, subscribe to Podiatry Marketing. We're really enjoying doing the show for you guys. If you have questions, feel free to head over to our website, podiatry.marketing. Fill out a form. Let us know some topics you think would be interesting for the show. But thanks again, Tyson, for today and your discussion on open loops. And I'll talk to you soon.
Okay, Jim. I will talk again next week. Bye.
Sounds good, Tyson.